WestMed presents the Vibralung Acoustical Percussor, an innovative technology indicated as an airway secretion clearance device designed for effective, efficient, and safe airway clearance. Before using the Vibralung, refer to your physician's prescription or caregiver's instructions for appropriate button settings to use during treatment. Also, please refer to the hard copy Instructions for Use provided with your Vibralung. The Vibralung is supplied in 2 boxes. One box holds the reusable treatment control unit and battery charger. The other box contains the disposable handheld transducer assembly, standard Y adapter, mouthpiece and variable expiratory resistor, and aerosol Y adapter that can be used for aerosol therapy. Remove the treatment control unit and battery charger from the shipping box. Peel adhesive backing from the 4 rubber feet and affix them to the underside of the treatment control unit to level it. The treatment control unit has 2 electrical jacks on the left side panel. The top jack is for connecting the treatment control unit to the handheld transducer. The bottom jack to connect to the battery charger. Plug the battery charger cable into the bottom jack located on the left side of the treatment control unit. Plug the battery charger into a standard electrical outlet. The charging and power LEDs should stay on during the charging process. Leave the battery charger plugged in until the treatment control unit's internal batteries are fully charged, which should take no more than 4 hours. The charging LED will turn off, and the power LED will flash when the unit is fully charged. Disconnect the battery charger after batteries are charged, as the treatment control unit will not operate while the charger is connected. Turn the treatment control unit on by pressing the power button once. The power on self-test will occur immediately as shown by all 9 LEDs on the treatment control unit flashing 3 times. The pause and power LEDs will remain illuminated. If other LEDs are illuminated, or if no LEDs are illuminated, the treatment control unit failed the power on self-test and should not be used. Contact WestMed customer service. The treatment control unit is now ready to use. Repeat these steps each time the treatment control unit needs to be recharged, as indicated by the low battery LED. Now assemble the Vibralung handheld transducer. Connect the long end of the standard Y adapter to the cone. The mouthpiece should be at the other end, and the variable expiratory resistor should be on the tail of the Y. The outlet part of the cone should be at the 3 o'clock position as you are facing it, and the assembly should be aligned as shown. There are 7 user-selectable button settings on the treatment control unit that illuminate when pressed. Press the power button setting to turn the treatment control unit on or off. Press the play-pause button setting to start, pause, or resume a treatment session. The L button setting is for low-frequency treatment of 5 to 350 Hz. The M button setting is for medium frequency treatment of 5 to 660 Hz. The H button setting is for high frequency treatment of 5 to 1200 Hz. The R2 button setting is for a 2-minute period of random noise treatment of 5 to 1200 Hz. The R5 button setting is for a 5-minute period of random noise treatment of 5 to 1200 Hz. Plug the handheld transducer into the treatment control unit. Press the power on-off button. Press one of the 5 setting buttons in the top row corresponding with prescribed treatment. The selected button will illuminate. For example, M for medium frequency treatment. Press the play-pause button to activate the device at the selected setting. Press the play-pause button to pause the session. Press the play-pause button to resume the session. If a paused session is not resumed within 2 minutes by pressing the play-pause button again, the session automatically terminates. If the patient perceives a point during treatment that feels especially beneficial, a treatment hold can be activated, where the 4-tone sound pattern of the patient's choosing will be played for 2 minutes. The treatment hold is activated by pressing and releasing the treatment button setting currently being used. The treatment hold is in effect as indicated by the blinking of the power button's LED. The treatment hold can be discontinued before the 2 minutes has expired by again pressing and releasing the currently selected treatment button setting. The power button's LED will then stop blinking. Treatment hold time is added to the total treatment time. Again, before using the Vibralung, refer to your physician's prescription or caregiver's instructions for appropriate button settings to use during treatment. Patients should be sitting upright or at no more than a 30-degree recumbent angle to facilitate coughing and expectoration. Place the mouthpiece in the mouth and seal lips around it just tightly enough to maintain comfortable seal. The teeth may rest gently on the mouthpiece, but do not bite down or chew on the mouthpiece. Positive expiratory pressure, or PEP therapy, aids in mobilizing secretions. Minimal PEP is applied when the orifice is completely open at 60 degrees. Maximum PEP is applied when the orifice is at the minimal position of 10 degrees. Once the steps discussed in operating instructions are completed, sounds will be emitted from the handheld transducer, indicating that treatment is in effect. The sound waves reach and treat both large and small airways. The patient should breathe normally during treatment. As with any breathing treatment, hyperventilation or excessively deep or fast breathing may result in dizziness or lightheadedness. The treatment may be paused at any time and resumed if the patient needs to rest. The treatment control unit should undergo surface disinfection on a daily basis to minimize surface contamination. Clean all external surfaces with a pre-moistened germicidal wipe product, such as Clorox disinfecting wipes. Ensure that moisture does not enter the case of the treatment control unit at the seams or at the 2 electrical jacks. Wipe down all surfaces of the handheld transducer. Please refer to Vibralung's instructions for use, included in the package for full instructions on how to appropriately clean all components and proper disposal.